Hello, and thank you for joining us. My name is Kathleen Anderson Ross, and I'm here today with my husband, Gary S. Ross, MD. Dr. Ross is a longtime medical doctor in San Francisco and Santa Barbara, California, the author of Depression and Your Thyroid, 2006 from New Harbinger Publications. We believe that there is always hope, there's always a solution, and it's finding a solution, trusting the process, figuring out what is needed, trusting the process, believing that there is a solution, and keeping the faith, keeping hope. And he has 35 plus years of experience seeing one person slowly at a time, treating each person as an individual. So today we're talking about thyroid, solutions for treating low thyroid condition. So, Dr. Ross?
Thank you, Kathleen. Well, in thinking about low thyroid, we've seen so many people coming in over the last 20 or 30 years with this problem. Even more lately, it seems to be increasing a bit for reasons I'll go over in this presentation. And it's good to know, really, that there are two basic types of low thyroid presentations. One is the situation where the thyroid system has just become slower. It has become less active, less able to produce thyroid hormone. There isn't anything really terribly wrong with it, like an autoimmune problem. It's just tired, it's run down, or the peripheral system is run down and the patient isn't getting enough thyroid hormone produced, or maybe not getting enough into their cells. The other main kind of low thyroid is what we call Hashimoto's thyroiditis, which is a low-grade autoimmune condition where the thyroid gland in the front of the neck here, below the Adam's apple, becomes infiltrated by autoimmune cells, white blood cells. And this is important to know, and it's important to do tests, as we'll get to in a few minutes, to find out, does the patient have just plain low thyroid, or does the patient have low thyroid because of Hashimoto's thyroiditis? And I should say that there's a third type of low thyroid, which is really referred to as peripheral hypothyroidism, or sometimes it's referred to as tissue hypothyroidism, where the thyroid gland itself, whether it has Hashimoto's or not, it just has trouble getting the thyroid hormone out to the cells out in the periphery, in the kidneys, in the liver, in the muscles, have trouble absorbing the thyroid hormone. So this is referred to in thyroid circles as peripheral or tissue hypothyroidism, and sometimes doesn't show up as well on blood tests. So now that we've talked about that, we'll go into some deeper factors or causes that we have to think about in figuring out, well, why does the person even have a low thyroid? What is going on that even triggered that in the first place? Well, so the first thing to think about would be some sort of a weakness of another organ, like, for instance, the adrenal glands. There is a connection between the adrenal glands, which make cortisone and DHEA and other hormones, sort of supporting the thyroid function. And if the adrenals, because of stress, become tired out, that also triggers a stress on the thyroid system, and unfortunately, it can cause a degree of hypothyroidism. Also, lack of iodine in general is another big reason why people get these low thyroid problems. The body needs iodine from seaweed, from iodized salt, from something in order to actually make thyroid hormone. And if that amount of iodine is deficient, unfortunately, not enough of the actual thyroid hormone can be produced. So lack of iodine is a factor, and as we'll talk about in a couple of minutes, there's a nice test that can be done. Also, chemicals in the environment. Unfortunately, there are a lot of them. There's chlorine, fluorine, bromine, there's also mercury, there's also various other farm chemicals and rocket fuel exhausts that do get into the river water and do get into our drinking water. One of those rocket fuel exhausts is called perchlorate. A lot has been written about it, and these chemicals can interfere with the body's ability to get the thyroid working well, to get the iodine into the thyroid gland. So if a person is exposed to perchlorates and fluorine and chlorine, and their iodine level is fairly low, they're probably going to get a low thyroid condition just because not enough iodine is getting into the gland to be used. And also, there are other similar deficiencies that can contribute to all this, including minerals like zinc and selenium, and vitamins like the B complex vitamins, vitamin A, vitamin D, and even vitamin E are all involved either in the production of thyroid hormone or in the peripheral release of thyroid hormone into the peripheral cells of the entire body.
And fortunately, there are some excellent lab tests that can be done to determine what vitamins exactly are needed, and as well as the thyroid levels and adrenals, correct?
Absolutely, and I can
Mm-hmm.
talk about those briefly next. So when thyroid is really evaluated thoroughly by somebody who is really trying to get to the root of it, it's necessary to check the basic thyroid blood tests, including the TSH, the T3, the T4, and the thyroid antibodies, which look at the presence of these antibodies which go up in Hashimoto's thyroiditis. But in addition to those basic thyroid tests, which need to be done very thoroughly and very completely, I have found over the many years that it's very useful to check a person's adrenal function, to check their daily cortisone production and DHEA levels, which are adrenal hormones, which we'll talk about in subsequent presentations.
Mm-hmm.
And also, I think it's very useful to check a blood test of some sort that checks vitamin levels and mineral levels like selenium and zinc and vitamin E and vitamin A and all of the B complex. There are several labs across the country, at least 3 or 4, that offer these special vitamin panels, and we recommend them very strongly. One of the labs we use a lot is SpectraCell Labs
Mm-hmm.
out of Texas, and there are several other labs. Genova Labs does a very good job with this, and there are at least 2 other labs, including Vitamin Diagnostic Laboratory in New Jersey, that does a fine job also.
Also, it's now known as health diagnostics.
Yes, now
Mm-hmm.
changed their name to Health
Mm-hmm.
Diagnostics,
Mm-hmm.
but those kinds of tests give a very broad view of not only what is the thyroid hormone level, but also what are these underlying factors that could be causing this um, in the first place. So once those tests are done and the patient's clinical presentation, how they feel, do they feel tired, do they feel cold, do they have dry skin, are there infertility issues, are there sleep problems, what other signs and symptoms are there that would fit a low thyroid picture? Once that is looked at, along with the blood results, which we'll talk about in subsequent discussions, you then get to the issue of what are the treatment choices for low thyroid. Well,
Mm-hmm.
the first treatment choice, which doesn't apply to everybody but can be very helpful in a lot of cases, is the use of iodine. Now, if a person has, for instance, and here are some iodines just to
Pill
show you,
form and drop
dropper
form.
form, liquid
Mm-hmm.
iodine.
Uh-huh.
And so iodine is very, very good, but has to be used carefully if a person does have Hashimoto's thyroiditis, because it's possible that it could make it worse in some cases, especially too much iodine. But in a person who just simply has a tired thyroid system, the iodine can really just about treat everything. And more research is available now on iodine. going way back to a book written by a Vermont country doctor about 40 years ago. I believe it was called Vermont Folk Medicine by Dr. Jarvis.
We have it on one of these shelves here still, a
Hmm.
little paperback.
He talked about using iodine in treating not only farm animals, because back then he was everything. He was the vet and the MD, but he, of course, gave it to his human patients too, and noticed an increase in their well-being and their fertility and everything. So it goes way back, but more recently there have been more articles and more studies on iodine. So iodine is very, very helpful. Just has to be used a little carefully if the person comes in and clearly has Hashimoto's thyroiditis.
So it's very important to know what type of thyroid you're treating.
Yes, in some cases, in addition to the blood tests and other tests we just talked about, it might be a good idea to do an ultrasound of the thyroid to just make sure
If needed.
there aren't any big lumps or bumps in there, because they also could theoretically change with perhaps too much iodine, but then again, little bits of iodine might be helpful. So it's an individual judgment call that has to be worked out, with the doctor. But aside from iodine, there also are prescription thyroid pills. The one that we find ourselves prescribing quite a bit is the porcine type thyroid, which is either made by the Armor company
I don't
or
have one of those right now, but I do have these.
or the Nature Thyroid company, which is this one. And Nature Thyroid for many years has been available as Nature Thyroid and West Thyroid as alternatives to Armor, but they're all prescription items. And more recently, in the last year or so, Nature Thyroid has come out with a new version
Which
of
I
Nature
held out
Thyroid
here.
called WP
WP.
Thyroid, which is great, which we've had great success with, and it seems to have a coconut-based filler, which people do better with generally and report a more noticeable clarity mentally when they switch from the other porcine products to um, this one, to WP.
But it's on an individual basis. Everybody's different,
Yes, and
right?
some people just go back to Armor because it works the best. It really works the best for them. So there are these porcine products, and then there are real prescription synthetic
These are
forms.
prescription, though.
Yes,
These are.
yes, those are. But there are these other prescription products that are you've all heard of, like Synthroid, for example, or Levoxyl, and these are brand names of T4 preparations. They're just pure T4 preparations. They don't contain all the ingredients that are in the porcine products, which contain T1 and T2 and T3 and T4. So it's just a T4 preparation. We've had some patients that have done extremely well just with T4 preparations, but in general, people seem to be missing something when they just use T4 preparations. And for that reason, sometimes we find it better to switch them over either to the porcine products, which contain the whole mixture of thyroid hormones, or they do sell by prescription a T3 tablet, a pure T3 tablet called Cytomel, now available as a generic also. And Cytomel, or T3, does definitely supplement the T4 and makes people function better because it delivers T3, the active thyroid hormone, to the cells. So it is less dependent upon selenium and zinc and B vitamins in order to make that T3 get there.
But isn't it nice to have a compounded T3 for many people like me? You can have smaller amounts and made according to exactly what that person needs.
Correct. And we've found many compounding pharmacies across the country that do a great job with compounding both T4 products and T3 products in very minute dosages. Like, for instance, commercially available Synthroid, the smallest dose you can get by prescription is a 25 microgram tablet, but through compounding pharmacies, that can be done in a much lower dose, like 2 micrograms or 4 micrograms or 8 micrograms. So it gives the doctor more freedom to get that person perfectly set up with the right dose of T4 and T3 to really make them really feel good and really hum.
And also remember that what's really important with everything that Dr. Ross is saying is that you are an individual and you might think you have tried everything already, but if you're not yet feeling fabulous or you're not yet feeling yourself like you got your life back, then you know that you need some fine tuning. So remember, there's hope. There's always a different way, a combination of things, changing the dose, fine tuning it. There's so much you can do. So you can feel great. You really can get yourself back. And as one of our female patients mentioned the other day, that she felt that she was a new woman. And before that, she felt like she was fine. So there's a new level and there's a better way. And just don't give up and know that the understanding and learning keeps going on until we figure out the right dose for you as the individual that you really are.
Thank you, Kathleen. And just the end of that list of possible treatments could go on and on also, but I do want to say that we also are aware, and many nutritionists and other people try to put patients on nutritional products, glandular types of thyroid, and those things are also very useful. So it really is an individual situation, as Kathleen was just saying,
Yes.
in terms of what we want to start with, what works the best. Sometimes we have to switch products and change products to get to the one that really makes a person really feel terrific.
And it's a wonderful feeling when we get it and the person is feeling great. And and then you kind of forget that you ever had trouble. So it's wonderful. Well, is that it for today?
That's it for now.
Well, this is the first of many, and we hope this has been helpful to you. Please look up our websites. Dr. Ross is rosshealth.com, ROS as in Sam, S as in Sam, HEALTH.com. And mine is KathleenAndersonRoss.com. We'd love to get your feedback, hear your questions that we can address in future episodes. And thank you so much for being here. And we wish you all the best in health and feeling absolutely wonderful in your life.